Now, the recent death of 22 young people in a tavern in East London has caused the spotlight, or rather cast a spotlight on underage drinking in South Africa. The World Health Organization says the country is the world's sixth largest consumer of alcohol. Studies have found that 50% of the country's youth have tried or consumed alcohol, with statistics showing that young people are drinking from as young as 13. We talk more on this, and we're joined now by South African Medical Research Council Alcohol, Tobacco and Other Drug Research Unit Director, Professor Charles Parry, Safe Citizen founder and National Coordinator Jonathan Deal, Central Drug Authority Marketing and Communications Chairperson Peter Ucko. Gentlemen, good evening, and thank you very much for your time and for joining us tonight here on In Focus. Prof. Parry, we've had this conversation a number of times, especially during the lockdown, but we're continuing, I suppose, to be looking at this conversation. Massive growth in nightclubs, taverns and shebeens, particularly around densely populated areas in South Africa. Is this phenomenon related with the heavy drinking in South Africa?
Well, certainly availability is one of the factors that drives consumption levels and heavy drinking. So, international research shows that the more liquor outlets you have, or the longer time periods that outlets are open, you will have more drinking, and consequently you will have more alcohol-related harm. So certainly there would be a correlation if more outlets are set up.
Yeah. And are you then at a higher risk in South Africa of being assaulted with a gun inside or near an alcohol outlet?
Well, the odds would be high. I mean, the case we're talking about today sounds more like a hit than an alcohol-related incident. We don't, necessarily presume that the perpetrators were drunk. They probably weren't. Whereas we do have, it's unusual what happened today, because normally you have violence related to one or two people are drinking, and the one person gets injured or killed, and the other person's often intoxicated. So there is a lot of violence around outlets. Often it's stabbing, so not so often guns, but guns are obviously an issue, and if people drink, their ability to control their behavior does decrease. Yeah.
And Peter, let's bring you in here, and let's have a little bit of a conversation around that. I mean, maintaining safe nightlife and establishments free of guns seems to be a little bit of a challenge in South Africa. Is it generally the fact that we have a poor strategy in terms of gun control in the country? Peter, I don't know if you can hear me there.
I can hear you.
Yes.
But you went dead for a while, and I didn't know you were addressing me.
Oh, all right. There you are. That's a question for you. I mean, do we generally have a poor control of guns, especially in the nightlife establishments in this country?
Unquestionably, that's so. But I'm not an expert on the gun laws or on gun usage. We just know South Africa is a massive per capita murder country in the world. And that's very disturbing. The truth is that alcohol leads to abuse of guns when people get high or when there's business competition. There are all sorts of problems with that. My concern is more about the alcohol and the alcohol control and the taverns, many of which are not licensed and which do not control. We see it with the death of those 20-odd people who were poisoned. Age limits, they were between 13 and 16 or 17. It's insanity. We need the government to make the laws which have been lying in the Department of Health and the Department of Trade and Industry for 11 years. The bill from the Department of Trade and Industry has gone stagnant, it's died. The law, which is sitting in the Department of Health, by the way, from 2011, Charles Parry will remember that at a conference in Durban, there was a discussion. I made a presentation about alcohol control based on the tobacco control model. That presentation led to the drafting of legislation, some of which became a Department of Trade and Industry bill, which deals with things like advertising and so on. But the health aspects, the addiction aspects, the fact that alcohol is a Class A carcinogen hasn't been addressed by the Department of Health. The draft legislation is lying there. We need to get it activated. we need to modernize it and take into account what's happened in the last 10 years and make that into law. That's the way we need to do it. In addition, that law must compel the law enforcement authorities to take action so that raids and shebeens deal with the underage children and deal with the unlicensed shebeens and deal with those people who just are not complying with the legislation in general. Remove a lot of licenses, close a lot of shebeens, and we'll have a lot more health.
Yeah, yeah. All right, let's bring Jonathan in here. Jonathan, you have a very interesting approach that you are taking to community safety, particularly as Safe Citizens, the NGO that you represent, which promotes the presence of guns in communities. There are some who are saying that the reason why we are seeing these violent acts, particularly in nightlife, but generally in South Africa, taking place is directly related to the availability of illegal guns in particular. But it goes further, Jonathan, to say those illegal guns now were legal previously, and therefore this is also because of a poor control of those who obtain these guns legally that they end up in the hands of the wrong people. Just reflect on that a little.
Thaba, thank you for that. I'd like to start off by supporting the observation of Charles and, in fact, statistics from the South African Medical Research Council, which showed recently that knives, in fact, are the preferred murder weapon in South Africa. Having said that, I don't think that guns are the big issue here. I think the issue here is that effective implementation of government policy is simply missing in action. And ultimately, the government has a responsibility to provide an environment in which communities can pursue sustainable development before the community can be expected to play its own vital role in managing these problems. And the bottom line is that this issue that we're facing this evening, the tragedy that this country has experienced in this weekend, will not be solved to any useful degree until the government steps up to its plate. Grandiose statements and plans and statements in the SONA or around election time take us no closer to creating a united community where young people can feel that they have a future and something to live for. And to expect the communities to have to stand up and manage this on their own in the absence of effective and visible policing is just nonsensical.
Yeah. So do you think there is in place an effective and comprehensive system of managing the guns that are in the hands of the citizens in this country?
Absolutely. And at a time where we have just digested a report in the Daily Maverick warning us of the potential for another insurrection in this country, it should not be forgotten that it was private citizens, lawfully armed private citizens in KwaZulu-Natal that saved this government from that insurrection probably spreading across this entire country. It was those citizens in KwaZulu-Natal that were manning and protecting the local communities and supplying the police with ammunition that brought that to a halt. I'm not suggesting that that is a desirable situation at all. I think the police should be able to manage the police work and leave private citizens to live safely and securely. But private and lawfully owned firearms in this country are not the problem. The problem is a distinct lack of leadership at the highest levels of our administration, a complete dearth of a good example of ethics in the way that we live and manage ourselves. And it's at the highest levels of our society. So what example have the young people in this country to follow?
Yeah. Professor Charles Parry, speaking of an example of young people to follow, there are, of course, debates currently going on in the country, including some labor organizations saying the kind of, for example, deaths that we saw this past weekend, but also the ones that we're talking about, the 21 in East London over the past two weeks, is as a result of socioeconomic deterioration. And so people, because of the socioeconomic deterioration, having no employment, having no place to go, having no inspiration, having nothing to do, the one thing that they resort to is alcohol. Is there a relationship between the deterioration of the economies and the social life of people in terms of not being able to have an outlet of creativity, of expressing themselves, and them resorting to alcohol? What do your studies tell?
Yeah, I mean, it's a complex range of factors, and I think we've touched on some of them. Certainly, poverty and the lack. If we look at the Enyobeni tragedy, the lack of recreation facilities made that tavern an attractive place for these young people to go when they finish their exams. They were enticed there by advertisements reaching out to young people, advertisements of free Wi-Fi, free alcohol, and this was the place to go. It was the cool place, probably where there was music, and it was the best deal going in that one of the things that people could do in that community. So I think we do have to look at the conditions in our communities and the recreational opportunities, and certainly get to grips with that. There was a great example of what happened in Iceland several years ago, when over the winter months, young people were heavily into use of alcohol and drugs. And what they did was, obviously it's a different society to ours, but they made many more recreational opportunities available to these young people. And it did bring down the substance use. But there's no magic bullets. I mean, we hear the president talking about raising the drinking age to 21. Well, none of those children they were all younger than 18. So certainly we can have a debate about that. My own view is it should be 19. But there are no magic bullets. Yes, we have to deal with the socioeconomic conditions. We have to deal, as was said by Peter, about the legislative environment, the things there. We have to deal with the licensing and control of alcohol, the availability. And one of the things we're hearing is that why weren't these outlets inspected properly by the liquor inspectors? And one of the reasons was there's so few of them in that province. So, one idea I have is we can certainly raise money for that quite easily by having a differentiated license fees according to the amount of alcohol sold by an outlet. If you're in the Western Cape, for example, you pay under 5,000 Rand for a liquor license, whether you're a restaurant or a macro or a small liquor store. And certainly we should be raising the license fees by the volumes of alcohol. There's absolutely no reason that shebeens, which are selling huge amounts of alcohol, or macros, should be paying 5,000 Rand for a liquor license. We need to raise that so that you can have money for a proper inspectorate. We also need to ask questions about the police in these communities. Did they not know what was going on, after 2 o'clock? I mean, this outlet in Enyobeni had a 2 a.m. License to operate till 2 a.m. And I have a question about whether really that's appropriate in a residential community to have an outlet till 2 a.m. And so, what were the police doing? Did they not have the resources? Were they staying in the police station? And so there was a failure on so many levels. There was the community which didn't have the resources. There were the community members which were disempowered to complain about the outlet. There was the licensing the license inspectors weren't going out. The police weren't going out. That some of the parenting, I don't want to criticize the parents too much at this stage, but what is your 13-year-old child or 15-year-old child doing out at 2 a.m. in the morning? So there are many things we need to look at, and there's no magic bullets, but we need to address all of them on all these fronts to really have an impact. The price of alcohol is very cheap, the marketing and so on.
Yeah. Peter, while we are there, are these establishments taking sufficient steps, in your view, to ensure that they monitor and prevent underage drinking?
The simple answer is no. I think they take 0 steps. They do nothing because they are concerned only about sales and profit. That's all they're worried about. They're not caring who dies in their establishments. They're not caring about kids who get drunk and maybe become alcoholics, because a certain percentage of people who drink alcohol will become bona fide alcoholics. And that puts an enormous burden on society. But I endorse entirely what both Charles and Jonathan have said. This is a package that has to be implemented of many things at the same time that need to be done. I'd like to address one of those issues, and that is advertising of alcohol. The alcohol industry knows that a ban is coming. We've known this for maybe 10 years. So what have they done? They're flooding television and other outlets with advertising of alcohol. But they never tell you about what alcohol is and does and can do, and the harms to individuals, to families, and very importantly, the harm that it causes to society. The adverts are all about lifestyle. Let's go out there and drink brand X of a certain beer, or it doesn't matter if it's hardtack or whatever it is, but you drink this and you're going to party. You drink this and you're going to be the life and soul of the party. You drink this and you're going to be the intelligent guy who makes an impact on his community. It's all about lifestyle. They never tell you about the harms that alcohol can do. And that's the legislative environment. We have to bring in what I call ARPS, AAPS, advertising, alcohol advertising, promotion, and sponsorship. Total ban. A total ban of all those things. And I think that'll add to reducing the harms caused by alcohol to individuals, families, communities, and society at large.
So, Peter, whenever that is raised, they're saying, well, what you are advocating for is for us to become a nanny state. Why should government be telling us what to consume and what not to consume, right? So is there a relationship, as you are saying, directly between what is being advertised on our television, papers, and so on and so forth, and the rate with which people continue to consume or maybe increase their consumption of alcohol? I see you, Prof. I'll come to you in a moment as well. Peter, go for it.
There's no question about that, yes. If that weren't the case, because remember, the alcohol industry is driven by one objective, just one objective, to make a profit, to pay dividends to shareholders. So they have to sell more and more of their products in order to make that profit, to pay the dividends to shareholders. How do they do that? Advertising. They know that advertising works. Otherwise, they wouldn't do it. Why, if it didn't work, would they waste money on advertising? So the industry has a responsibility. I think that the industry itself is a cause, indirectly, of those deaths. Now, is it the nanny state? That's an old argument used by both the tobacco industry and the alcohol industry.
All right. Jonathan, I see you as well.
We need the state. Can I just then end by saying that what constitutes a nanny state? The state has a responsibility to protect its citizens. And to protect the citizens, they have to do a few things, like Charles said, provide an environment of entertainment for the young people so they don't end up in the shebeens. You can't, for example, are we a nanny state because you can't beat your own children into submission when they do naughty things? You're not allowed to do that. You can't hit your children. So where does a nanny state start and end? I think the state has a responsibility to save lives, protect our communities. Save lives, save lives. We don't want people dying.
Jonathan, you can jump in here, and then I'm going to come to you, Prof.
Thank you, Thabo. I think that Peter's got a very, very valid point around the advertising. The excesses in the communities are very much glorified by social media and by advertising, and it creates a path, an undesirable path for young people to try and emulate, even whilst they are living in the middle of poverty and unemployment, and where much of the money received on social grants goes to alcohol instead of groceries and household expenses. But I think the underlying factor is that in South Africa, where we have very diverse communities, off-the-shelf solutions to laws and regulations, a one-size-fits-all approach is not going to work. What works in a tavern in Pietermaritzburg or Gugulethu might not necessarily be sustainable or even workable in a more affluent suburb. And we should also realize, I think, that the community has got a very specific role to play and an ability to play that role in developing interventions in the community at community level. But once again, they cannot do it until the infrastructure is there from the government to enable that intervention and that participation from the community. And at the moment, I'm afraid the feedback that I have from our members around the country, and we have a wide demographic in our membership, is that they are feeling abandoned and lost and without the support that they need from the government.
Prof, I see you raising your hand on the question of the direct relationship between advertising and the degrees to which people consume alcohol. You wanted to jump in there?
Yeah, just 2 points quickly. The industry would say that advertising is to help people to make brand choice. But in fact, the data clearly shows that advertising helps younger people, makes them drink sooner and in greater quantities. And there's even research coming out of the MRC where we've shown links between marketing and consumption in this country. The other thing about the nanny state, I think it's very easy to have to mock government actions, and the same happens with the sin taxes. In fact, the sin taxes, the alcohol taxes, actually should probably be called a health tax. They're not getting people who are sinning. They're aimed at improving public health of the people in the country.
Yeah. So what value are we really getting from the current legislation that is in place? Because there's this broad conversation to say, no, we need reforms of alcohol legislation. Alcohol laws in South Africa are too lenient. What value are we currently getting? Or maybe what value we could possibly be getting that we are not getting?
Shall I jump in first?
Yeah.
There are, as I said, there are no magic bullets, but let's look at the legislative environment, because I think we have a weak legislative environment. We do have laws. I mean, one of the better areas is our taxation, which does increase with inflation every year, but even that's got behind. And I think there are reforms we need there. We need to look at particularly the taxation of alcohol, fruit-flavored beverages, which should be taxed at the level of spirits and not at the level of beer. And certainly the evidence from the World Health Organization and elsewhere is that, taxation is probably the best method of dealing with alcohol, reducing harmful use of alcohol. We also have a very sort of confusing mixed legislation with falling under the Department of Trade and Industry, which now includes proposed legislation around raising the drinking age, controlling advertising, and so on. And it's really confusing that there's a lot of health and social aspects which are included in this legislation by Department of Trade and Industry, which certainly has not shown, the minister has not shown any interest, as far as we can tell, in moving forward with that legislation. So I think we also have the proposed legislation around drink driving, lowering the maximum BAC level to 0 or 0.02, which I think would be better. That was approved by Cabinet in March 2020, gone nowhere. And so we really need, and the marketing bill, the control of marketing of alcoholic beverages bill, which was approved by Cabinet in 2013, got bogged down in socioeconomic impact assessments and gone nowhere. So we still currently leave it to the liquor industry to really regulate alcohol adverts and self-regulate, and that's not working. So we really need to sit down as a country and say, let's look at our legislation. Other countries around in Africa have done this. Let's look at where it's weak. Let's tighten it up in areas around marketing, around prices. Do we need minimum unit pricing, around drink driving, around treatment, and so forth? And really get that in shape, and then deal with some of the other aspects, like how do we make that legislation work in practice? How do we pay for the inspectors? How do we get the 60-70% of outlets which are unlicensed, unregulated, either into the regulated market or closed down completely? So we really have a very laissez-faire legislative environment, and it does need tightening up substantially.
Come back in a moment. Peter, I saw your hand there. We'll come back and get your answer after the break. Here's a question we've been asking you tonight on the poll. Can South Africa succeed in curbing underage drinking? At Newzroom 405, please reply with a yes or a no. We'll bring you the results in just a moment. You're also sending us your WhatsApp comments tonight on 072-110-5584. Anonymous saying, as long as those smaller taverns and clubs and townships are permitted to sell alcohol, then we'll never win. Only big retailers are adhering to laws and regulations on the liquor board. Another one saying our biggest enemy here is the lack of leadership. This is unacceptable, rather, I beg your pardon, period. That is some of the thoughts tonight on Twitter. Keep them coming. 072-110-5584. Tweet us tonight at Newzroom 405. We'll continue in a moment. Back with you tonight on In Focus. Can South Africa successfully curb underage drinking? It's the question tonight. South African Medical Research Council Alcohol, Tobacco and Other Drug Research Unit Director, Professor Charles Parry, with us. Safe Citizen founder and National Coordinator, Jonathan Deal. Central Drug Authority Marketing and Communications Chairperson, Peter Ucko, also with us. Before the break, Peter, I was asking the question, what value are we getting from our current legislative framework if we are deriving any? Because generally, whenever this is raised, I think Social Development raised it again recently, the other agencies are raising it as well. The knee-jerk reaction from everyone is that South Africa has got enough legislation, we just need to implement it. What value, then, are we getting from the current legislation that is in place, if any?
Very, very little, Thabo. Let me just make one correction. I'm representing TAG, the Tobacco, Alcohol and Gambling Advisory, Advocacy and Action Group, not the Central Drug Authority.
My goodness. All right. Thank you very much.
I have a lot of experience, 8 years of experience with the Central Drug Authority and working with Charles Parry on this thing for a long time. So what value are we getting? Very, very little. If you look at the licensing legislation, for example, every province has their own licensing rules. There should be one system that is imposed nationally. And that's not being a nanny state. That's just regularizing and making things much, much easier. We also have to stop, for example, the industry interference in the legislative process. And that's why we have to ban not only advertising, but promotion and sponsorship. Because the industry sponsors political parties. So the political parties get a little soft on making laws against one of their big sponsors. Now, what happened? I'll give you an example. In this bill, which is going around of the Department of Trade and Industry, there was a partial ban on advertising in one of the early drafts. And there were things like alcohol advertising will be allowed after 10 o'clock at night. Now, we know that that does not work. So I spoke to Derek Hanekom at one function which was discussing the process of the bill and the drafting of the legislation. And I appeared to convince him that the only thing that would work, that is appropriate, is a total ban on advertising. The next draft that came out indeed had legislation and wording towards a total ban on advertising alcohol products. A little while later, a month or two later, the draft was changed and the original was put back, which allowed advertising with some controls like after 10 o'clock at night. So how did that happen? How did the minister listen to me, a public health advocate and somebody who works in public health and wants to save lives, convince the minister, he put it into action, and a little while later, whoever was unconvinced. How did that happen? That didn't happen because somebody sat down and said, you know what, I think we'll go back to draft one. That happened because I am 100% convinced of this. I don't have evidence of it and I don't have proof of it, but there's absolutely no doubt in my mind that the industry got to the legislators and the drafters and officials and politicians and convinced them that they would take care of advertising responsibly. It's like they talk about drink responsibly. That's a lot of their advertising. The message is, they say in words, drink responsibly. What the real message is, the underlying message is drink. Because if you've had a beer or 5 or 10, then there's no more responsibility. So the advertising must be totally banned because the industry itself is not responsible. We go back to their primary objective, the only objective. To make a profit, to pay dividends to shareholders. And so the industry must be cut out of the legislative process, totally.
Jonathan, let's bring you in here. Earlier on, Prof. Parry was citing the World Health Organization and their approach to public health when it comes to drinking. But their approach when it comes to gun control, here's what they say. They say the most consistent predictor of gun violence is a history of violent behavior, including witnessing violence. In addition, the easy availability or access of firearms, whether in a home or in a community, constitutes one of the key risk factors. How do you deal with that kind of opinion around the availability of guns? And I understand, of course, the context of a history of violent behavior and the context of having seen violence previously.
Thabo, with respect to the World Health Organization, South Africa is not a typical country amongst countries in the world. We have very different demographics in this country. We have a police force that at the moment is completely inept and completely unable to protect its citizens. And we have an extremely violent society. And it should also not be forgotten that there are millions of people who are law-abiding citizens with and without firearms. And each one of them has the right to expect to have personal security cherished and protected as is expected or intended in our Bill of Rights. I think that what we need to understand or remember is that the government has got the power to enforce specific legislation, and specifically around this alcohol issue. For me, the low-hanging fruit is the advertising. It's things like the road traffic laws, things that can be definitely controlled quickly and effectively, and certainly the advertising is a big one. But if we are expecting to try and control the informal sector, in other words, the shebeens, in the short term, given the complete inability of the police to manage their duties, then we're on a hiding to nothing. I think that in the short to medium term, South Africans and communities and everybody with a voice needs to start holding this government accountable to the service delivery that they owe our citizens.
Is there an understanding amongst communities, maybe not so much in the affluent areas, but particularly in the less affluent areas, of a general understanding of sound security practices? Because as you put it, we are living in a different country as opposed to Australia, where a reduction of availability of firearms has resulted in positive results, and that's the study that is quoted by the WHO. But of course, in South Africa, with a poor strategy of managing guns that are out there, establishments themselves need to take it upon themselves as opposed to bring a degree of security. So is there a wide understanding of proper security practices in those establishments, in communities that sell alcohol?
There is not a wide understanding or an effective understanding. The community police forums and the community safety forums are largely, or by and large, ineffective. There are some nice exceptions, but by and large they are ineffective because local politics and a dearth of resources at the police stations play a great role. So the community police forum chairs that have no offices, they have no place from which to do their work. They are relegated to working from a counter in the charge office. So one can't expect those structures to be effective until the police are properly resourced and led properly, and the government is actually doing something about it on the larger scale.
So how can then those communities in those areas channel their efforts?
Well, I think that one has got to also understand that in many of the communities, intimidation is a very significant factor. So when somebody comes in and they start tramping on toes where there are established networks of distributing alcohol or distributing illicit substances, they have to have very big shoes on in terms of being brave enough to actually continue that in the community in which they live. So it's very difficult for people that are privileged to live in a community where there's maybe a more visible rule of law, or people are not living cheek by jowl, as is the case in so many of our communities. It may be easier to go to be the community police forum member in Sandton than it is in Gugulethu or Soweto. And we need to understand those realities before we can expect the community to make this work without the government, or the government standing by with their arms folded, in my view.
Yeah. Prof. Parry, how do we monitor adherence and enforce compliance I mean, maybe taxation to some level we are able to do, but of course we've seen during the COVID-19 pandemic there was a rise in illicit sales of alcohol, and those people avoided tax completely, and we lost in the billions. But for example, on issues like pricing, maybe marketing, because it's very public, one could be able to control that. Issues like pricing, issues like opening late, beyond your working hours, and so on and so forth, with a limited police force and a limited knowledge of security and what needs to be on the ground.
Yeah, I mean, you're right. I mean, people need to do the right thing, but sometimes you've got to check and monitor and have sanctions when people don't comply. So that's why I was talking about having a proper inspectorate and raising the funds for it from the liquor trade. The people who's selling alcohol, it's not an ordinary commodity. It's a privilege to be able to sell it. So the point I was making was their license fee should be directly related to their estimated volumes that they sold in the previous year, to raise the funds to pay for a proper inspection. Obviously, picking up on Jonathan's argument, one needs to have that properly managed to make sure that it's not just absorbing money and it's not being properly spent. So certainly I think we need to look at accountability in so many ways. And that's one of the views that if I was asked, I would say we need a 5 or 10 point strategy to deal with underage drinking. We need to clarify exactly what it is, what we're going to do. Maybe point number 1 will be deal with legislative weaknesses. Point number 2 will be control of marketing. But we need to have a clear plan of action. We need to develop a strategy for implementing it. Then we need targets that we can see, indicators to see how well we're doing in implementing that strategy, and then accountability to the public to say, this is what we've done, this is how we're managing it, and this is the effect in terms of the statistics around underage drinking, young people being injured and hurt and things like that. So we really should be demanding better value, I think, for our tax rands to make sure that the monies are being well spent. But we also need people to do the right thing. I mean, I was given an example here by one of my colleagues as I was talking, Maurice Smithers from the Southern African Alcohol Policy Alliance. And he was telling me he was watching a program on ETV this afternoon called Jumanji. And apparently every second alcohol advert was an alcohol advert during a program which was a children's program. So there are things we need, organizations that are advertising or having programming to be responsible in terms of, if you're going to have advertising, to not do that sort of thing. We also need to look at our legislation. We have a bill called the Bella Bill, which is the Basic Education Laws Amendment Bill, which talks about making it very clear that schools can sell alcohol to raise funds. And I think we need to raise the question, is that appropriate? Okay, we can let staff on school premises, they live in their own houses, of course they can consume alcohol, but should we be having sales of alcohol to raise money which children are exposed to, when the stagnant or the non-liquor amendment bill talks about no alcohol establishments within 500 meters of a school, and yet we've got the basic education ministry trying to legitimatize the sale of alcohol. So I think some of these nonsensical things, we need people to do the right thing, but obviously we need to have monitoring and accountability. But I see my friend.
I see. Jonathan wants to come in and Peter wants to come in. Peter, let me give it to you because you have been quiet for a while. Have we defined what the problem is and therefore have conducted the necessary research, and then are we at a stage where we can say we now need to come up with a strategy, or we still need to maybe search a little bit more as to what the problem is that leads to the kind of challenges that we are now seeing?
I think we don't need research to tell us what the problem is and what the strategy should be. We know what the strategy should be. And government has a conflict. And the conflict is, for example, between Department of Trade and Industry, the Department of Finance, and the Department of Health, and of course, Department of Social Development and others. So what is the conflict? And I'd like to make a correction. The Minister of Trade and Industry with whom I spoke, thanks to a correction that Charles Parry passed on to me, was Rob Davies, where he removed the partial ban, replaced it with a total ban, and then changed it back to a partial ban. That's industry interference. That's one of the strategies that we have to apply. So they have a conflict that they want jobs. So if we have an alcohol industry and a gun industry selling lots of ammunition, those create jobs and it creates tax income, just that to start with. But the special tax that we need to have on alcohol products needs to be implemented in a very specific way. The problem is that it doesn't always increase at the rate of inflation because it's a misguided argument from both the Department of Finance and the alcohol industry. When you increase the tax portion of the retail selling price beyond inflation, the net effect on the retail selling price, what the customer pays for a product, is much, much less than inflation. Just look at the last budget, and I'm not going to go into all those figures, but where the tax increased by, let's say, 5 rand on a bottle of spirits. What is that on a bottle of whiskey that cost 500 rand? It's paltry, it's negligible, it's worthless, it's meaningless. So what we have to do is introduce a tax system which, in the words of Professor Iraj Abedian, who's an economist, said it has to be applied in such a way that consistently applied, in such a way that it progressively makes the product less affordable. So that we know from all the things that we've done, this package of things that we can do, like banning advertising and all the other things that we can do, the most effective and the largest contributor to the reduction of consumption is affordability. If we progressively make alcohol products less affordable, we will make sure that consumption goes down. The conflict of government is that if consumption goes down, their tax income goes down.
So it's the pricing. Unfortunately, I am pressed for time, so we're out of time. Jonathan, I'll give you the last minute. Just your final thoughts there.
Thank you very much. Thabo, I think the two common denominators in this discussion are police and alcohol. And if this problem is expected to be solved by the application and enforcement of laws and legislation under the current police force that we have, then unfortunately we have our answer in terms of what changes we can actually expect, whether it's enforcing advertising laws, or whether it's enforcing drunk driving laws, or whether it's enforcing shebeen closing times. Until the government, and particularly the police, who we expect to protect us, get their act together, it's very difficult for the community to step up to the plate.
Gentlemen, I appreciate your time. Thank you very much for coming on. Unfortunately, completely out of time. Prof. Charles Parry, Peter Ucko, and Jonathan Deal there. That's where we leave it for tonight. Of course, that conversation continues. We'll come back in a moment with your poll results. You're back with us tonight here on In Focus. Quick look at what the poll results have for you. We asked the question earlier on, can South Africa succeed in curbing underage drinking? You replied as follows: 18.9% of you saying yes, while 81.1% of you saying no. Those were your thoughts tonight on that score. Some reaction then on Twitter to the question tonight. It will never be curbed because government does not take it seriously. All they do is corruption, not address real issues destroying the youth. One Buzz Lightyear, I beg your pardon, saying it starts at home, having a solid home with good values. Our biggest enemy here is a lack of leadership. This is unacceptable, period. As long as those smaller taverns and clubs in townships are permitted to sell alcohol, then we'll never win. Only big retailers are adhering to laws and regulations of the Liquor Board. Some of your thoughts tonight then on this conversation.